Dr. Jayabalan Valliyappan. I'm the obstetrician and gynecologist in Pantai Hospital, and my special interest is fertility treatment. Now we come to treatment modalities available for infertility. First, we start with some simple treatment methods. Again, the treatment depends on the cause of the infertility. The problem is the ovulation, right? Most of the time it can be corrected, right, by simple general measures like decreasing the weight. All right, if the woman is obese, we will teach them some exercise methods, dietary advice, and because in obese women, the extra fat produces hormones, and then these hormones makes the hormone imbalance more, worsen the hormone imbalance actually, right? So by decreasing the weight about 3 to 5% a month, we can help the woman to ovulate better, right? And there are also some certain medications to help the ovulation process, right? There are ovulation sensitive inducers like clomiphene citrate, right? If they are not responding to medications, then we go for injectable medications and to induce ovulation, right? This is ovulation. Let's say a tube is blocked. If one single tube is blocked, we can still go for a intrauterine insemination. That means we stimulate the woman's ovary to produce more eggs. At the 10th day or 12th day, when she is ovulating, we will inject the processed sperm inside the uterus. It's like this. During a normal intercourse, the sperms are deposited into the vagina, and then the sperm has to move all the way into the uterus, to the fundus of the uterus, to reach the eggs, which will be somewhere here at the tubes, right? In case of intrauterine insemination, we will be processing the sperms for 2 hours and get the most active sperms and inject the sperms directly with the help of this kind of tube directly into the vagina, go all the way through and deposit the sperms into the uterine cavity. So this is intrauterine insemination method, which is done here. All right. So by intrauterine insemination, we are increasing the likelihood of the sperms to go into the uterus and meet the eggs. For this process, if one single tube is blocked, it's still all right. But both the tubes are blocked, we cannot do a intrauterine insemination. We have to go for a next step called in vitro fertilization method, which is otherwise called test tube babies. Actually, talking about test tube babies, we have been doing this in Malaysia for the last 12 years, but the first test tube baby is, the name is Louis Brown. 25 years ago in UK, the first baby was born, right? So doing a test tube baby, the indication is, let's say a woman fails to get pregnant with IUI 4 to 6 times, or both the tubes are blocked, or the sperms are very low in number. Right? How do we do in vitro fertilization? Again, the method is very simple. On the second day, before that, we have to prepare the woman or the couple for a in vitro fertilization by means of some laparoscope, clear the tubes, right, and prepare them in terms of hormonal balance, optimize the hormonal levels, and once she's ready for IVF, on the second day of the menses, we will be giving her some injections. From the second day to the 10th day, she will be given injections to stimulate the eggs, right? Once the eggs are mature, which is around the 12th day, we will aspirate the eggs from the ovary, right? The mature eggs will be aspirated from the ovary, and the eggs will be fertilized with the sperms which is produced at the same time by means of masturbation. All right. So the sperms and the eggs will be left to fertilize on their own. There's another method called intracytoplasmic sperm injection. That means we just get a one good sperm and inject the sperm into the egg, right? So this is manually. In IVF, we are letting the sperms and the eggs meet on their own outside the uterine cavity. In ICSI or intracytoplasmic sperm injection, we are actually injecting the sperm into the egg, all right? So this is done in case of very low sperm count, right? So in both these methods, the embryo is formed on the same day, and after the third day, the embryo reaches a stage called 5 or 8 cell stage. Then this embryo, which is prepared outside the uterus, is transferred into the uterus on the day 3, after the IVF. The embryo transfer will be something like the intrauterine insemination or IUI, where the embryo is slowly and gently deposited into the uterine cavity here. After the embryo transfer, the couple got to wait for 3 weeks to find out whether they are pregnant or not, or she is pregnant or not. Alright, we'll do a blood test called serum beta hCG. We'll see the pregnancy hormone levels, and if the hormone levels are good, that means she is pregnant. Alright, let's say somebody is not pregnant, what will happen? She will get a menses as usual on the 2nd or 3rd week, right? Sometimes the thing can get delayed, and you can ask me how successful is IUI or IVF. IUI is done for everybody. Whoever have difficult to get pregnant will do IUI, provided the other parameters or the other factors are correct. Alright, the IUI pregnancy rate is about 20 to 30% in our center, and for IVF it's about again 30 to 40%, because IVF is done for selected cases.